Hi, I'm Don Lamb, and I specialize in bladder cancer. We see a lot of patients from all over the country. And many people come and really don't know what they need to bring and what's important in bladder cancer. So this little talk is to let you know what to bring and what's important. The critical information is the pathology. And there are two most important items on the pathology report that every patient with bladder cancer really should know. And those are, one, the tumor grade, and two, the tumor stage. Grade is the appearance of the cancer under the microscope, the appearance of the cells. And for low-grade tumors, these tumors look nearly normal. Very little variation. Low-grade tumors have a benign course, and they're not really dangerous in most cases. The high-grade tumors, however, are very abnormal in appearance. The cells are irregular, they have large nuclei, and they're very variable. And the high-grade tumors are dangerous, and these are the ones that fortunately that BCG is most effective against. The other thing you need to know is the stage. What you would like to see is a non-invasive tumor. That's one that doesn't invade the bladder at all. A tumor that's limited to the superficial lining of the bladder. These tumors are early and can be treated very, very effectively. Once invasion starts to occur, then there's a much greater risk for further invasion. The next stage is T1, where the cells have gone under the lining, the inner lining of the bladder, into the supportive layer, or it's called lamina propria. But once invasion occurs, then it's much more dangerous. So we are very interested in knowing the grade and the stage, because that determines which treatment is best. For the low-grade tumors, a simple transurethral resection, that's where we remove the tumor from using a scope that's inserted in the urethra, followed by a single installation of chemotherapy, of medicine that kills cancer cells right at the time of the surgery. That lowers the risk that these cells will implant in the bladder. For the higher grade tumors, we do the intravesical single installation, but also follow up with a course of BCG immunotherapy. So most patients today are actually not treated according to the recommended national and international guidelines. There's often good reason for that, but it's important for patients to know what those guidelines are, so if they're not being followed, they can ask their doctor why and get a good explanation. And we will be publishing very soon on our website, bcgoncology.com, and in the future on a blog which we will develop, a patient translation of the national guidelines, international guidelines for the treatment of bladder cancer. Thank you.